Welcome to Brockton Hospital's EMR tutorial video. The point and purpose of this video is to provide a resource for providers who have not had the ability to have one-on-one training as of yet or need a refresher on how to utilize the present electronic medical record at Brockton Hospital. Our present platform that we utilize is the Meditech 6.15 platform. And prior to starting at Brockton Hospital, providers should have received their username, password, and PIN, which would have been sent to them either through their office manager or through Outlook signature email. Let's begin. Upon arrival at the hospital, if a provider is entering onto one of the regular units or floors, most of the terminals are logged in utilizing a generic sign-on. In this situation, you can see on my present screen, I'm logged in at present as a generic sign-on. Providers can utilize their username and password to log into the network. At that point, they would be able to access and utilize all the present desktop applications that you see. Typically, however, as I mentioned, most terminals are logged in utilizing a generic sign-on, and in this case you can tell by looking in the upper right hand corner here, New ED, which is a generic sign-on typically seen in the emergency department. One note of caution is if you should note a mnemonic there that has an MD or NUR or a provider's mnemonic, you should log off and re-log in utilizing your own network username and password, as if you continue under the present mnemonic, you would be logging in as that provider. And this could create, obviously, an issue with signing and access. Now a brief overview of the present applications that you most likely will see and interact with. Beginning here, you'll see the green flame, which is the network edition. This is our dragon icon. It is a separate application which needs to be open and can be utilized for voice recognition and documentation. This is a separate training and needs to be required to set up. Please see the medical staff office if you have not been signed up or had training for Dragon. Below that, you'll notice the Signature Healthcare Citrix icon. This icon is the icon typically that can be utilized for accessing the present network and applications from home. Providers who wish to access the Meditech or other applications from home will need to download Citrix to their own personal devices, and once done, we'll be able to access the applications from home utilizing Citrix. Below that, you'll also see the Signature Healthcare webmail. Outlook, Signature Healthcare Outlook emails are created for all providers at the time of them beginning service. Signet, this icon here, is indicating our internal web page. And in this page is utilized for things such as policies and procedures, informational resource to employees. Also, it contains educational resources as well, such as the physician page, which is typically used to communicate changes, updates, and other informational updates. You'll notice over to the left this green icon. This is Allscripts. This is the outpatient EHR. Signature Medical Group utilizes Allscripts, and this requires a separate username and password and can be provided if applied for through your office manager. Moving to the Meditech icons, you'll notice here the Meditech MT. This is our Meditech Live version. Below that, I have Meditech Test, which we will be utilizing during this tutorial in order to demonstrate different functionality and context. So to begin, after logging in, or if you sit down at a terminal and you're logged in as a generic sign-on, as I am at this point, simply by clicking on the Meditech icon, you will need to enter your username and password. Once you've done so, you will need to choose the appropriate job that you are presently assigned to. In this situation, it would be as an ER provider. All other providers would sign in as provider job. This is our first screen that you'll encounter. From here, clinical, physician care manager, or the ED tracker if you're an ED provider, but most providers will function and work under the physician care manager. The first screen that will appear will be the message and task. In this functionality, you will see any incomplete records that may need to be addressed here. Also, our consults will appear here. Consults, I don't have any listed here, would be a separate line. The patient's name, who requested the consult, and regarding, such as the complaint and the time placed, would be here. Providers could simply click on that icon or the patient's name, thus allowing them access to all of the tabs you see here on the right, and be able to perform the consult after reviewing pertinent lab findings and then providing the appropriate consult documentation. From here, we go to patient lists. This is typically how patients can be found. There's any number of ways, and providers have their own personal preference. Typically, any location, starting at the bottom here, if you happen to know where the patient is located, on what floor, this can be utilized to find any unit in the hospital. Inpatient units are listed at the top, outpatient below, and by clicking on the individual unit, you are able to see every individual that is located in a bed by name. If, for example, I wish to add this patient to my rounding list or to my patient lists, I can simply check the box to the right, as noted over here on the right hand side, and on the footer I can place add to my list. It is recommended that you place them on my patients round list and my all patient list. By clicking yes, this patient will now appear on my rounding list. I also have the ability to remove patients from my list at any time as well, following a similar means in doing this. When I click on lists at the bottom, and now I come to my patients at the top, you'll see that the patient I chose is now listed on my patients. You'll notice in Meditech, oftentimes there's no forward or back button, but typically there are tabs. The white tabs tell you what fields you're looking at and the best way to orient yourself. In this situation, we're looking at the patient lists, and you can see it's my patients, and this is designated to me because I have either signed up for the patient or I was listed as the attending. It is of note that if you're a consultant and you are consulted on a case, you will need to manually add a patient to your list. It will not automatically maintain on your list. Now what we're looking at here is essentially called a two-tiered view. You'll notice this green line indicates the chart we're presently looking at. It has some information along this tracker. You'll note you will need to move the screen to the right, from left to right, as there is additional information that is not viewed on the screen. And to open a chart, you'll notice by clicking on the patient, it does not open the chart. But to open the chart instead, you need to come to the far left-hand side in the empty column. You'll notice my cursor turned from an arrow cursor into a hand. Another important point is that the cursor, whenever you see the hand functionality, you have, this means additional click functionality, right click or left click. Keep that in mind as we proceed. Opening this patient's chart, then, you'll notice that we default to what we call the summary view, clinical summary to be specific. Again, the white tabs indicate what I'm looking at. With this patient's chart now open, I have a number of biographical and biostatistical information. You'll see the patient's name, age, date of birth, their status. In this situation, the patient's admitted in, their room number, and in the center, you can see they have any allergies or adverse reactions. Their code status would be listed here, as well as any height, weight, and BMI. Over here we can see that this is a patient account number. It is designated by the F number and the medical record number, which follows it here. Under here, providers are able to access a variety of information, and this is a great screen to begin with. For example, you can review legal indicators that may be present on the patient, demographics, certainly as contacts, family members that may need to be spoken with regarding the patient, and this provides a good resource to review patient information when seeing the patient for the first time. Returning to clinical summary, again you can see special indicators that are here. You'll be able to review any active medications, home medications, and in this situation we have a test patient, so there's not a lot of information listed. Having reviewed this, providers now have a brief, or at least a topical understanding of what's going on with this patient. You'll notice to the right, once I'm in, the tabs to the right, these we call our radio buttons, or tabs, have the ability to review a variety of information. To the right here, if we go sequentially, looking at patient lists, which we just came from, and we were here, We can also do Find Patient and look a patient up by name or account number, whichever the preference or you may choose. Going back to patient lists and opening a patient's chart, you'll notice then there are certain icons that are all red lettered. This is a visual indicator specifically to indicate to you that there is new information that has come in on the patient since the last time you logged in or reviewed this patient's chart. This is user specific. In reviewing the clinical summary from here, we certainly could go to select visits. This is an important feature as well, I'd like to point out. It defaults to the present visit. In this situation it's test, so it's not showing us that. But this is where you can review prior visits by the patient. And below here, which is grayed out, as this is our test module and not a live patient, this View PCI. This is an important button because this would help providers to review any pertinent information from the medical record which may be prior to 2015. The reason being is we've recently updated with this new Meditech 6.15 system, and not all of the old or previous medical records or documents have migrated into our new system. This would be a great resource, an area to go to review any additional visits if the patient was hospitalized prior to 2015 here. Going back to our Summary tab, another important piece of information in review. If you're reviewing for medical records, you'll notice at the bottom the external application, and there is several functionality and different algorithms here. The two that I wish to point out at this time are the BID Medical Center Web OMR. If this should be a patient who is regularly cared for by the BID medical system, and the patient is cared for by specialists there or primary, by clicking on this link, you will have access to that patient's chart in the BI system. Also, I would like to point out 3M360 Encompass, which is a query-based system where queries are sent to providers regarding updating or further documentation for patient billing and for patient documentation. Moving back to our tabs, the Review Visit button gives overview of the patient's stay. Patient message task is not being used at this time. History and problems is a list of the patient's active problem list. This can be updated, it can be amended, and it can be reviewed from prior histories. New results, if there were any new results, this would be of course red lettered, and those results would be displayed. Clinical panels, these are 60 disease specific or process specific panels that are used in order to reduce clicks and providing a number of data points, information, and statistics for specific either procedures or disease specific. These have not been optimized yet, but are a resource. Vital signs, I&O, and medications are all simple review and rather intuitive. Laboratory, microbiology, blood bank as well will not go into in depth. Moving to reports, however, this is an important feature and an overview. Again, reports are anything that are physician authored. This would be including of op notes, cardiology reports, EKG reports, any consults, operative notes, EKGs as such, all would be reviewed under reports. Providers create reports, they do not create notes, so it's important to keep that in mind when we get to documentation. From here you're able to access and review by specialty, if certain specialties have documented on the chart, what their documents are. By clicking on the report, you're able to see, in this case, a discharge summary, the report that may have been started, in this case, draft, to review. Moving to patient care, this is where nursing provides their assessments as well as all of their documentation. And notes, which is below that and is low lit, is where ancillary departments such as nutrition, respiratory, physical therapy, case management, and social work document on their patients. At this point, you'll notice if there will be a small thin green line. This is a great point to show you. At this point, from message and task all the way down through here to notes, we can consider these are view buttons. In essence, we've really done nothing to the patient but review pertinent information reports, data, etc. Now we move to our do buttons, which are ordering, ambulatory orders, discharging, and documenting and signing, to review and understand how now we will interact, document, and interact with the patient for placing orders. Moving to our patient, if we move to the orders, which is actually the computerized physician order entry, or CPOE. When we click on that, what we are confronted with is the white tab again, showing us what we're looking at, current orders. These are the current orders on an active inpatient, which we can review at this time. In reviewing these orders, I'd like to point out that we have current orders, which are active, and you can see the status here on the left-hand side, ordered, collected, etc. Transfer orders, which we'll talk about in a moment. History, to review any orders that have been performed on this patient during the hospital stay. New orders, which would now give us the ability to order any orderable interventions. Medications, again, any medications to be ordered. We have a variety of order sets that are being utilized by specialty throughout the organization. Restorable is not a functionality we are using at this time. Briefly, under current orders, you will notice here that we've got several orders that have been placed. A consult to social service, consult to gastroenterology. We also have some labs, and we have some medications. I'd like to show just briefly a couple of the functionalities of basics, and more detailed discussion certainly can be had by reaching out to the medical staff office regarding more pertinent or specific questions. But in general, medications as they're ordered, and you can see now presently active on this patient. If, for example, I'd like to modify the morphine dose on this patient, the way to do that is by simply clicking on the medication. You'll see here it's grayed out and it's ordered. It's recommended that you edit the original order. So I would edit this order if I wanted to change the dose, and in this situation decrease the dose, making it 2 milligrams. I would submit. Of course, I will need to place a pin because I've changed the order. And after placing my pin, you will notice that now the morphine is changed to 2 milligrams Q4 hours, and the original 4 milligrams, there's been a stop requested. I also have the ability, if I wish to hold this medication, I could place hold. It would ask me when, how long, and when do I want to resume, if it be the case, to hold a medication. These are your essential functionalities that we would use in ordering medications. Another note for ordering medications, at this time it's important to note that if medications need to be ordered at different time intervals, for example such as Cinemet, a dose at 7 a.m., noon, and 5 p.m., there will need to be 3 separate orders placed for that type of ordering. Also, while we're talking about medications, in ordering medications, you'll notice it defaults to favorites, but we need a new medications and name. Simply type ahead and we'll begin to look up. As you find your medication, it is preferred that you choose the route of administration versus the drug, thus limiting the number of strings that you would see. And in placing that, you will see it will minimize. Tylenol, of course, has a lot of strings, but I at this point can choose the appropriate tablet and frequency that I'd like to give, scheduled, one time, etc. In this situation, we'll do 325 milligrams. You'll notice that I have a red edit, which means I do need to address some questions regarding this. Because it's a PRN, I do need to place in a reason for this. And in doing so, I now have a submit ability. I can place that order by placing my PIN, and I have ordered the appropriate medication. When it comes to medication ordering, there are 3 other specific ordering scenarios that you need to be aware of. One would be also a protocol. There are a variety of medications that may be given through protocol. In these, for example, if I go to medication, and if I wanted to order a protocol order, such as Ativan, and I wanted to order the Ativan protocol, Now, what's not intuitive here is it says 0, but what I need to do at this point is I actually need to delete the 0, open this up. I need to see protocol, which you'll see now below creates this required field. By now opening this, I can choose the lorazepam protocol, which drops in. This is how you typically would do any protocol order that's attached, as you can see. I can submit this, and in doing so, I've initiated a protocol order. You'll notice that with this indicated by a P. By clicking on it, it will tell me what the actual protocol is whenever you see that symbol. Another order specific or unique ordering availability is by weight-based protocol. For example, things such as Lovenox. So if I went to, again, my medication, I went to Lovenox and I wanted to order at 1 milligram per kilogram, in this situation weight-based. I could certainly choose a string that I think is close, maybe to what the patient's weight is. At this point, I could certainly edit it, and since there is a weight on file here, as you can see at top, I could certainly change this and go to a dose calculator. I can put in the amount that I want, which is 1 milligram, and it's per kilogram. It will then calculate for me its 84 kilograms. And at this point, the formula, I'm going to use the actual body weight, and it calculates it for me. By clicking OK, I've now chosen the appropriate milligram per kilogram dose, and I can file that. The last unique ordering opportunity would be tapers. In the situation here, certainly we would look at something like prednisone, and by choosing prednisone to demonstrate a taper at this point, what we can do is we can place the prednisone PO. I can begin, let's say, at 50 milligrams daily. If that's the top end dose that I'm using, we can start it today. As if I edit once again this, and I change this now to a taper, C taper, you'll notice that the taper now becomes highlight. I can certainly make an adjustment to what my tapering schedule would be. In this case, it's 30 it's a 2-day, 3-day, however I would like to do it. In this situation, I could say I'd like to go with 50 milligrams and every 3 days, and you can see my taper is dropped in. I have the ability to edit this if I so choose for a different tapering schedule. I can place that order, place my pin, it is now an active order. Those are the 3 unique ordering scenarios that you may encounter, which again include protocols, taper, and weight-based scenarios. Another thing I'd like to point out while we're ordering is sets, and under new sets we have categories of sets. Here, specialty order sets, depending on what specialty you may be in, you will notice order sets that have been developed for your specialty. These have been developed by the chief and approved. Certain order sets have pre-checked values and would need to be unchecked if you feel they're not clinically accurate. And any changes or concerns you may have regarding utilization or possibly expanding them, please check with your section chief. Briefly, for example, in this situation, if we go to the medical, and I go to admit to general medical, this would be the general admit to medicine order set. And you'll notice here that it's outlined utilizing the most common orders that we would see on admission. We utilize the 80-20% rule. 80% of the time, what is it that we provide for patients on a regular basis? That makes up the majority of these order sets. However, it also provides an ability to add any order, a la carte ordering if you will, that an order that is not in your order set that you could add. Those orders would appear at the bottom of your order set. You'll notice here there are several protocols in this order set. There's also here an intervention that may be involved. Drug monograms are indicated here. And you would be able to work through this order set, answer any queries, and once you've answered all of the necessary required queries, the submit button would be highlighted and you would be able to place your orders. This is again a brief overview of ordering and utilizing order sets, both for new orders, medications, and sets. You do have the ability to create favorites. This manage favorites buttons would In this situation, I have several favorites, quite a few if you will, that maybe I have placed. And this just helps it create an easier impact on ordering, less clicking, and ability to find the things that you want quicker. Now, coming back to summary, again, this tends to be the hub of where you can find most of your information and review clinical data. I would like to point out that from the ordering standpoint, and at least from the review point, medications, they are critical. In the organization, the expectation is that med reconciliation will be completed during the hospital course, on admission, and at the time of discharge. It is a continuum and a collaborative effort that's going to be performed by nursing and by the provider, but ultimately the provider, discharging provider, is responsible for an accurate discharge medication list. So let's look briefly at admission. On admission, if this patient is now being evaluated by you as the admitting provider, you would look at the patient's home medications which may have been populated by nursing. At this point, you'll notice the list. If there are any additions or corrections that may need to be made, you can do so by clicking on the blue Edit. This will launch you into the patient's actual home medication list. You have the ability to add new medications. If, for example, a patient is taking a medication home that's not listed here. In this scenario, let's say that it's aspirin. Choosing the appropriate string, 81 milligrams daily is what they take. I've added that to their medication list and updated it. You'll note too as well that if you wish to review any outside medications, as oftentimes there are multiple sources that create the patient's home medication list, we have something of a vendor called Doctor First. By clicking on the external medication history, you have the ability to look to outpatient pharmacies where recent prescriptions have been filled, by who, when, and the quantity of the refill. In this situation, you can see by clicking on the header here, I can change the time from when it was filled. So most recently, I could look back and note that this patient has had a fair number of pain medications filled dating back. This provides a great resource to be able to confirm patient's medication list, or if a patient doesn't know their medication, or if you're concerned about possible diversion or drug-seeking type behavior. Having done that and made sure first of all we have an accurate home medication list, at that point I would go into the orders, and in this situation, if the patient was being admitted under the current orders here, I could certainly do their reconciliation at this point. You see the red, which indicates that it has not been done. By clicking on Reconcile, if the patient had home medications listed here, and this is the test environment, I certainly could work through and choose to continue those medications on this hospital course. I could choose to hold those medications if clinically relevant, or I could also choose at that point to discontinue them. So med reconciliation is an important aspect of patient care. On admission, it can be performed and updated appropriately. The second point of which medication reconciliation can be performed is utilizing transfer orders. In speaking about transfer orders, we'll come back to that in a moment, but this basically is utilized when a patient is moving from one level of care, for example from the emergency department to the inpatient floor, or from the floor to the operating room, or from the ICU to the medical floor, and it allows providers to manage all of the active orders on the patient and add additional orders at that time. That would be a great time to reconcile medications and home medications if they've not been done as well. Moving from the ordering, we will now move to documentation. So if I've placed orders on this patient, which we've done a brief overview on, I now might need to document and place some documentation, such as a consult, a progress note, a history and physical, or perform an op note. In doing so, clicking on Document, I would then click on New, and from here I've already created favorites, which I would encourage you to do as well. But if I went to standard, you'll notice that there are all of the templates that are specialty specific templates. These have been created, and depending on your specialty, you should utilize your appropriate templates. You'll notice at the very top, and I mentioned this earlier, point out once again, notes. Providers do not document in notes. We create reports and we generate reports, and so both for inpatient and for ED providers, reports are what we utilize. In this situation, I'm going to take, for example, internal medicine H&P. By clicking on this, as if I'm going to admit the patient, you'll note that I have the headers across the top: history of present illness, review of systems, typical past medical, family, surgical history, medications, exam, results, assessment and plan, quality metrics, and in the situation, co-signature if required. Working through the appropriate fields, you'll notice starred fields, perhaps on some of the templates that you are documenting. Consultants have less. The internal medicine and surgical services tend to have a bit more. But it is required that you answer these queried fields in order to be able to successfully submit and complete your document. Working through each of these, most have a drop-down functionality in which you're able to place the time. The templates and documents have been created in concert with and to be utilized with voice recognition or Dragon. So for example, opening the patient's history of present illness, you'll see there's a leading statement, but then there is a free text editor. These documents have been designed that if, again, in this situation, I have opened Dragon here, and my Dragon is ready to be used, and I'm in my note, I can begin to dictate my HPI. The goal would be to utilize Dragon, and utilizing your mouse, you can move quickly through speaking and clicking through your documentation. Again, if you have not been trained, or if you wish to get additional training for Dragon and voice recognition, please contact the Medical Staff Educator Office to set up an appointment. Returning to our document, going through review of systems, many of the templates and documents have created normals. By clicking on the top N, that will create a normal exam, an entirely normal exam throughout the entire 12-point review of system. At that point, providers can choose then to go in and address any pertinent positives. For example, if this patient did have abdominal pain, you were able to change that and document abdominal pain. You'll notice immediately the cursor goes to the comment. This is where Dragon, you could certainly add additional information here that would be associated with the abdominal pain. One thing that's important to note again, the hand functionality, which was pointed out earlier. You'll notice that you have present and absent. What that means is while in these fields, you see my hand functionality over this query. If I right click, I have a pertinent negative, no coffee ground emesis. If I right click again, it removes it. If I left click, it's a pertinent positive, coffee ground emesis, and again I have the ability to add additional information or document. This is typically the way the review of systems and medical physical exam are arranged. Under medications, our home medication list we looked at earlier will pull into your note. Allergies will as well. Physical exam having been completed, any results, both laboratory and documenting EKGs, radiographic findings, you may add your annotation to those. Moving then to the assessment and plan, you'll note that some have flowed into the document already, which were chosen from the problem list earlier. At this point, you'll notice as well they default to acute or chronic, depending on how they were placed earlier. And starred fields are required for each ICD-10 code. There needs to be an assessment and plan. So for example, I need to open this and I now need to document what is my plan for the cellulitis and abscess of the hand. We need to do this for each of the documents. Answer my quality metrics. And if I'm an attending, I would not need a cosigner. If I'm a resident or a nurse practitioner or PA, I would need a cosignature, which will be placed at the time of signing the document. You would not need to click here. In the event that I need to come back or I need to draft this statement and finish it later, clicking Quick Save, this moves it into a draft status, as you can see here. It enables me then to go and see other patients. If I choose to come back and complete this document, I can then click on it. Shows me what I have completed so far. These blue headers are hyperlinks, which can take me back into the document. I can choose to delete or cancel this document at this time if I so chose, or if I wanted to finish my document, clicking Edit, I can now get back into my document, finish it. When I am completed, I would click View Save. At this point, if I am required to have a cosigner, I would need to put in the attending that will be cosigning this. For those that are attendings, you may see Assign Provider here. You should not assign a provider here. As the attending, you should sign the note of record that you are filling out. If you wish to add a CC to a provider, if you're a consultant, for example, nephrology, consulting on a patient and wishing to send your consult to the primary care or the hospitalist, this is where you would put the patient, the primary's name, but don't assign a provider. It automatically defaults to draft so you don't accidentally sign the note. At this point, if you had completed the record, you would move it to sign, put your PIN, and sign. Now would be a signed document. You would not be able to go back in and edit the document as it is signed. By clicking on the document, however, you could edit it and create an addendum, which would appear at the top. You'll note in this situation, I'm unable to sign or place my PIN because I've not done the required questions. If you're not sure as to why you're unable to do so, clicking on the required questions will take you back. As you can see, I've not filled out any of these required fields. Until I fill these out, I'm unable to sign or complete this document. So this concludes documentation. Moving now to discharge. This is an important feature as well. It is rather complex from the inpatient side and requires many steps. I would prefer again that you would contact the medical staff educator to set up an appointment to review the process in detail if you have not had the opportunity to do so already. What I will now cover is just a brief overview of the discharge process, beginning with patients that are discharged from an inpatient status versus patients that are discharged from a same-day surgery or outpatient status. These are very important points to consider. First of all, from the standpoint of discharge, for patients that are being discharged as from the inpatient side, all of the documentation, prescriptions, meaningful use, core measures, all of the required fields that are necessary for discharge and satisfying those are performed utilizing the specialty-specific document. For example, this patient, as you can see, is listed as an admin in. This is an inpatient. To discharge this patient, I would go to Document, which is what I'm in now, click on New, and I would choose from this standpoint the Internal Medicine Discharge Summary. This is where I will discharge the patient. On admission, anything that's done from the HPI and the history and physical will flow in. The hospital course, and you can see the diagnoses we spoke about earlier and the patient was treated for, would then have the ability to add or change any of these ICD-10 codes. I would then go to the hospital course. Again, free text. Utilizing Dragon, I'm able to dictate the hospital course. Once I've done that, discharge exam and plan. The plan tab here, as you can see at the very top, is really the hub of the discharge process. This plan functionality, which in Meditech Live will be actually the first bubble over here because it's so important, you'll notice at top you'll see what the active diagnoses are that have been treated during the hospital course. Discharge date is today. And then you'll need to answer a number of meaningful use queries, such as what is their activity level? What is the diet? These have been already addressed, as you can see. What's their functional capacity? And smoking status. You'll note then that as you move to the follow-up plan, you'll notice the discharge summary and medication reconciliation. Again, we mentioned this earlier. The patient is going home. This is an opportune time to reconcile their home medication list. By clicking on this, it will launch me back into a familiar screen that you will have seen before. When I click on the med reconciliation, you'll notice these are their home medications. At this point, I want to convert the medication list. So what now has happened is this. The patient's medications, which they have been taking here, indicated by these little icons, which actually are a little hospital icon, is asking the provider to determine what they would like to do with the visit medications. Should the patient not receive a prescription, in other words, it will simply discontinue when they're discharged. Should they continue that medication but no prescription given, and that might be the scenario of a patient going to a skilled nursing facility or long-term rehab. Or I'd like to give them a prescription. This was a new medication that I started, and they should continue taking it at home. This would be antibiotics, blood pressure medications, etc. Scrolling down through, you'll notice here down below, and this patient, again being a test patient, has already had some medications adjusted on their course already. And in this particular situation, you can see there's some RX. There's some prescriptions that have already been sent or prescribed for this patient. We have the ability to use e-scribing. You'll note that the patient does have a pharmacy listed, and if I was going to order or add any medications, I could certainly use e-scribing capability. For more detail, again, if you're not familiar with this, please check with the medical staff educator's office. I have the ability as well that if I wish to just simply continue all their home medications, I could utilize this function here at the bottom and simply would resume all their home medications. A word of warning, be sure that you've reviewed those medications so that it is appropriate that the patient takes them when they return home. If at this point you wish to add a medication that they are presently not on, you could choose any order and you could go to new medications, and at this point I could certainly add a new medication. In this case, I'm going to place them on Toprol XL, and I may want to put them on 50 milligram tab daily. I have the ability to see this hand functionality again. I could even change this to BID, and I could change this to, if I wanted to, only 14 tabs. Hit OK, and I've added this to, as you can see below here, as a new medication. From here, I would say next, and if I were to submit, as I've done my med reconciliation for its final, the Toprol XL comes up as the new medication I have prescribed. You'll notice that it defaults to the electronic e-prescribing. The patient has listed a preferred pharmacy, and if I wish, I could simply hit transmit print, and I could send that electronically to the pharmacy for the patient. I would recommend that you certainly confirm with the patient that that is their preferred pharmacy and that it has not changed since they may have been previously hospitalized. From there, if I hit transmit print, that will send. If the patient does not want it or does not have anything specified and you wish to print prescriptions, by unchecking that and choosing the second column, you'll see the printer prescription. And if I hit this point, transmit print, it will ask me to go to and connect to a local printer, and choosing an RX printer by address, which is listed on the printer on the unit you find yourself. At that point, you print the prescription on printer paper, and it would require a signature and to be placed on the patient's chart. That would complete our med reconciliation. The patient, from an inpatient standpoint, has also an expectation of the transition of care document, which is under forms. Go to the lookup and you'll see the transition of care document. This should be filled out. Reason for hospitalization, again using patient-friendly language. Once this is completed, and the follow-ups, again proceeding all the way to the bottom, and the disposition or wherever they may end up, I would place a discharge order, and I am completed my document. Again, this is just meant to be a brief overview. There is additional detail that can be provided, but in order to help with assisting in discharge. Now, from a standpoint, if this was a same-day surgical patient who would come to an outpatient surgery or endoscopy, the process would be a bit different. I'm going to cancel this note, and let's say that this patient was being discharged from a same-day surgery position. He's not admitted. Surgeons and those that are performing outpatient procedures should not go through the document, but instead go through Discharge Plan. Discharge Plan button, again, is to be utilized only for outpatient discharges, but you'll notice something very similar. This is basically the plan section only. It's from here the expectations are additional instructions. Part of the organizational expectations are that the same-day surgery instructions accompany the patient, which you can find through a list of standard text. In this case, I've created it as saved it as a favorite. And the discharge instructions have post-anesthesia instructions, activity, diet, medications, operative site and care, who to call, and this is the organizational expectation. Providers can create their own customized using Dragon and macros if they so desire. Again, please feel free to contact the Medical Staff Education Office to assist in creating this if you so desire. From here, you'll notice that the next thing is follow-up and then medication reconciliation. Again, so critical. It is the organizational expectation that medication reconciliation be performed on all patients, both inpatient and outpatient, those that come for procedures and those also in the emergency department. Again, you'd see the patient's home medication list, convert, patient's list, which we've already addressed earlier in the same scenario. For surgeons, if you say, I agree, this is what they take, you can say resume home medications. You could certainly do any order to add any pain medication, and you would complete, again, the process of med reconciliation, printing any prescriptions or e-prescribing. Schedule 2 narcotics cannot be e-prescribed, and they would need to be printed and signed. Placing then the disposition, discharge order, this is all that's required, along with the op note or the procedure note in the case of endoscopy. Your patient could then be discharged having completed all of the necessary requirements. Having completed the discharge process, albeit it is a bit tenuous and long, again, if you have questions regarding specifics of this, please feel free to reach out to the Medical Staff Education Office for further detail or information. Lastly, I'd like to go over just a few of the other notifications and messaging functionality. If you'll notice down in the right-hand lower quadrant here, there's a blue question mark. This is a resource that is built into Meditech. By clicking on here, this will give on-screen information and instruction regarding the present screen you're looking at. It has some interaction availability as well. Next to that is a globe icon, and this is designed to link out to associated links outside. We have things such as Isabel's differential diagnosis tool, corrected calcium calculator, MassPat, SigEd, up-to-date email, all scripts is in here as well. There's some resource links that you might want to utilize. Next to that is print, of course, lock, meaning lock this screen of the computer you're presently at. Email functionality is presently not active. And the last one is this exclamation point, which is where you would go to file incident report. In the event that there is an incident that occurs with your patient, it is the expectation that staff report that, and by placing the different incident codes, maybe there was a procedure-related property, some other maybe an equipment failure, and you would be able to ask or at least place the specific with the patient's information, detail that, and submit. So again, this is designed to be a general overview, and with this functionality and what we've discussed in this tutorial, you should be able to successfully log on to the Meditech, be able to identify the appropriate icons on the desktop. You should be able to obviously locate patient lists, sign up for patients, find patients, and subsequently review and open their chart. In reviewing and opening their chart, you should be able to review their current orders, being able to place orders, being able also to understand from a medication standpoint the aspects of medication reconciliation and the 3 aspects of it, which are at the time of admission, which at the time of transfer, and also at the time of discharge. Specifically with medications as well, the protocol, taper, and weight-based functionality, and how to change those appropriately as needed. And lastly, documentation, how to provide a specialty-specific document for your specialty, document appropriately, utilizing and accomplishing the required fields and submitting. And lastly, discharge. Again, the important feature here is if this patient is an inpatient, all inpatient discharges should be through the specialty-specific discharge document. Any same-day surgery or procedures that are outpatient should be through the Discharge Plan function. This concludes the overview tutorial of our EMR record, Meditech 6.15. Resources are further available in much more detail, and certainly additional elbow-to-elbow support, and any questions that might need to be addressed can be taken care of by contacting the Medical Staff Education Office at extension 17038.